I'm Dr. Ed Jeffries. I'm Medical Director for Blue Cross and Blue Shield of Louisiana's Quality Blue program. They've asked me to speak today about the importance of chronic disease in the Baton Rouge area and why we need to direct resources to it over the next 3 years. What is chronic disease? Chronic disease is defined as a disease that lasts for 1 year or more, necessitates physician visits, or interferes with certain activities, or both. So which chronic diseases are we most concerned with here in the Baton Rouge area? Diabetes, hypertension, chronic kidney disease, cardiovascular disease, stroke, obesity, chronic lung disease, hyperlipidemia, and cancer. The 2019 Louisiana Health Report Card showed that Louisiana is in the top 10, depending on your perspective, bottom 10, depending for the instance of all these chronic diseases. The prevalence in East Baton Rouge Parish for diabetes is 12%. For stroke is 3.8%. For hypertension is 39%. Chronic lung disease, 7.8%. Hyperlipidemia, 35%. Obesity, 38.2%. Coronary heart disease, 6.1%. New cancer diagnoses are diagnosed at the rate of 473 per 100,000 in Louisiana. The national average is 436 per 100,000. The population prevalence for these diseases also shows that with the exception of chronic lung disease, which is most prevalent in low-income white females, the populations most at risk are low-income African Americans. Latinos are also significantly affected. These groups are also disproportionately affected by the morbidities and mortalities associated with chronic disease. A recently released Blue Cross and Blue Shield report based on 2018's claims data showed how barriers to care for the control affected the control of hypertension, diabetes, and the care of cancer patients. And it was looked at in various areas of the state. Like, for instance, in the barriers to care for hypertension were looked at in the Baton Rouge area. Barriers to care for diabetes were looked at in the Shreveport area, and barriers to care for cancer patients were looked at in the New Orleans area. In Baton Rouge, zip codes 70714, 70802, 70805, 70811, and 70812, as well as 70814, basically the northern and northeastern portions of the parish, showed an increased prevalence of hypertension, and that these areas also had lower per capita incomes than the average per capita income of the rest of the city. Access restraints were the most prominent barriers associated with the elevated disease rates. These zip codes had multiple access factors that were influenced by access to households not having access to a vehicle, a higher percentage of single female-headed households, severe PCP deserts, and pharmacy deserts. Resource scarcity was profuse in zip codes with elevated hypertension and prevalence and lower per capita incomes. Also noted was that all across Baton Rouge, as well as in zip codes where there was an increased prevalence of diabetes, the medication possession ratios for diabetic medications was below percent. Medication ratio is the percentage of time a person would have access to their medication. Similar trends were noted in Shreveport for barriers to care in diabetic care, and also in New Orleans for barriers to care to cancer patients. This suggests that the patterns seen in Baton Rouge are not unique to Baton Rouge. All of this data strongly suggests that for the care of chronic diseases in East Baton Rouge and Ascension Parish, that there is a need for improved access to care and improved access to medication. Thank you.